we're just going to keep admitting people as they come in. I have Divakar from our team. I don't know if he's going to come on camera, but he's going to be like admitting people in the back end while we're starting here. So welcome everyone. This is going to be an informational webinar about Colorado University. Some disclaimers: this is not going to be about, the actual interview process itself, or, they're not here to tell you how to get, what are the exact interview questions or like the bench exam or nothing like that. But they're here to share their experience. They're here to answer your questions. I know that when there's an interview, everything's so confusing, everything's so fuzzy. So, when I asked, Julie, Namrata, and Asha, they were just so nice to say yes and be here today. So thank you guys for being here in spite of your busy schedules. I appreciate it very much.
Thank you for having us.
Thank you so much for having us. Happy to help.
And you guys, whoever is here attending, it would be great if you switch on your cameras. You can see our faces, sleepy, beautiful faces. So I see Priyanka, you're in camera. I appreciate that. Thank you very much. All right, so I'm going to share my screen. First thing, I'm going to show you something that's going to help us navigate this better. This is not what I wanted to share. Are you able to see the screen with slido.com, a QR code?
Yes.
Okay, so I've organized all of the questions that you guys asked us over here. So if you open this on your phone or computer or whatever, you'll be able to see the list of questions. What I want you to do is to basically just rank them in the order in which you would like them to be answered, and then we will get the results on our page. So we'll start answering them in the order of priority. Let me show you here. So right here, if you go to the poll section, you'll be able to. So you'll be able to see this, all of these questions, and you'll be able to basically add your ranking to it. And then once that's there, we'll go back to the answers and we'll be able to answer them in the order of preference. So I'll show the QR code again. So it's right here. And I can show it again when we start the Q&A session. All right. Okay, can you guys see my screen?
Is Asha here, Nourah?
Let me check.
I'm here.
Oh, okay.
Hi, Asha.
Hi, Asha.
Hey, can you guys hear me well?
Yes.
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 Here you go. Just want to make sure everybody's admitted here. Okay, awesome. All right, so welcome guys. Again, this is Colorado University's Mentor Huddle. So we're going to get started here, and I'll introduce myself. I am Nourah. I am currently in my advanced studying program at Southern Illinois University. I'll be graduating this June. And after that, I'm going to start my orthodontic residency at University of Illinois, Chicago. So I'm going to be going closer to Dewey. And I'm also the co-founder of Caapid Simplified with Karthik. Caapid Simplified is a company that Karthik and I started where we help international students who are applying to US dental schools. So right off the bat, I'm going to show you something that I recently started before we start off with the session. So this is my Instagram page, which I recently started. It's called Dr. Nourah Asana. It's something that's very close to my heart, so I wanted to share it with all of you. You can check it out and see if you want to follow me. I'm basically going to be talking, Karthik and I both are putting content relating to international dentists, orthodontics, and a little bit about fitness as well, amateur content. But here's that. And going ahead, this is our agenda for today. I'm going to be talking a little bit about housekeeping, and then I'll introduce our mentors for the day. And then I'm going to have each of our mentors take up each slide that they've put together for you. We'll talk about Colorado University and the international program. We'll talk about the admissions process itself. What kind of holistic review does CU do when they start looking at applicants, a broad perspective? And then we'll talk about how it is to live in Colorado, and then we'll go to the question and answer session. So the basic information part of it itself is going to be really quick. So we're going to spend a lot of time answering your questions. So for housekeeping, I'd really love if all of you just come on camera. It'll be nice if it'll be just more interactive. And if you just woke up or you're on bed, that's fine. After that, if you have any questions, we'll answer them towards the question and answer session. While the mentors are talking, we'll just be happy to just stop and listen. And if you have any questions, just put it in the comment section, or there's also an option to do it in Slido, which I shared. I'll also put the link of it in the comment section once I'm done talking and the mentors start talking. That's pretty much it. I'm not a very strict host. So don't worry about that. All right, let's go on to introducing our mentors. So first we have Dr. Namrata Patel. She did her BDS and graduated in 2013 from Dharmsingh Desai University in India. And then she practiced general dentistry for 2 years in India. She eventually started her international program at Colorado University. She graduated just last year in 2021, and she currently lives in Arizona, the dream state for everybody right now. And then we have Dr. Jui. She is also a CU alumni, graduated in 2021, is originally from Mumbai, India, where she graduated from MGM Dental College and Hospital in 2014. She's currently working with Familia Dental in Wisconsin as a lead family dentist. She loves being a family dentist, but her core interests are in endodontics and pediatric dentistry. So she sees herself specializing in the coming years. While in school, she worked with the American Association of Endodontics and her mentor, Dr. Vogelmoth, I hope I said that right, for poster presentation on RCT and the variation in number of appointments. She enjoys the dental school. Jui is just a very happy person as I know her. And in her words, she believes in spreading smiles at work and off work. So she says, keep smiling. And then we have Dr. Asha. She graduated BDS in 2014 and moved to the US in 2015. She did 1 year preceptorship in implantology at UCLA, 1 year of research internship at University of North Carolina, and worked as an assistant before getting into Colorado University. She's currently working as an associate in both private and corporate offices in Maryland. And then there's me. You know a lot about me, so I don't want to go on again. And I think we can go ahead and get started here. And I'll give it away to our mentors for this slide.
Hi, everyone. So I am ISP 2021, as Nourah said. I'm just going to give you a brief regarding University of Colorado. So University of Colorado is the only dental school in Rocky Mountain region, and it has 2 programs, which is like one regular and ISP program. DDS program is 4 year and ISP program is 24 months. 3 residency programs, GPR, orthodontics, and periodontics, and they are, I think, 2 year each. Advanced denting program for international dentists, as I said, it's 2 years, so which is nice. We start from January of 1 year and ends December of next year. So they accept 40 students each year, and which is like very fast-paced didactic and preclinical courses in first 2 semesters, which means we get lots of clinical experience. So patient care starts in 3rd semesters, and that's how you get more experience of all the patients. Additional elective courses and research projects are also available. As Nourah suggested, Zui did one of them and she did poster presentation. Some of my colleagues did research articles as well. So which is a beneficial part of it. Thank you.
And then let's start with how to apply to CU. You have to apply through CAPID, and then the timeline is from September to February. Usually, Colorado accepts anything above 95, 94, but the average TOEFL score in our batch was about 102 to 105. So target for anything above 100 at least, that's beneficial. And then we all know NBDE part 1 and part 2. I think we have the integrated exam. These days, I think they started it last year. So yeah, we need INBDE and either part 1 and part 2. And ADEA-AT is optional. Colorado doesn't persist on having ADEA-AT, but having that is always beneficial. Processing fee for the application is separate from CAPID. It's about $85. Then the second step is supplemental application. Once you get a go from Colorado, then they send you a supplemental application where you have to send them 2x2 photographs, resume, degree transcripts, and there's a set of questionnaire which we have to answer. And then we have LORs to be filled directly on the website. It is different from CAPID. So everything has to be sent differently from CAPID to Colorado. And then the third is once you submit your supplemental application, then you hear back from CU for the interview and the bench test. Usually interviews are held on rolling basis. What I mean by rolling basis is like I said, if you have the timeline is September to February. So if you have applied in September or October, then you will get the interview early, that is in April, and likewise. So there are virtual bench exam and interviews. So I think because of COVID, the last 2 years, there was virtual bench. This virtual bench and interview this year, I'm not sure. I think it's virtual, but I'm not sure. And then there are 3 batches, April, May, and June. There, they send out the acceptances by the end of June or in July. They also do sometimes early acceptances, but it depends. Sometimes they do, sometimes they don't. And like I said, the interviews are on rolling basis, but the admissions are not. So admissions are just after all the interviews are held, and then they send out the acceptances. And then if we can go to the next slide, Nourah. So CU basically gives a holistic approach to the candidates, what all it's looking for. There's nothing specific that it's looking, that, you know, experience, a number of years of experience, nothing like it. It's just an holistic approach. They want to know about your GPA. They need to have part 1, part 2, INBDE, then DDS, sorry, not DDS, the dental degree from your home country, SOP, that is personal statement, LORs, letter of recommendation, TOEFL, dental experience back in your home country. And if you don't have any, it's also fine. If you have any dental assisting experience in United States, working as a lab tech, I have worked as lab tech, it helps. Worked as, if you have worked as dental hygienist, it's nothing like it. You have patient experience, so it works, it helps. And observership, fellowship, externships, everything helps. I have a lot of people asking me, will this help me? Everything helps. Like, even the minus of one day something, one day's CE course, it helps. Everything helps. Okay. Moving on, research is also helpful. They are looking at your experience as a research assistant, teaching experience back in home country or here in the United States. Then volunteers, leadership programs, continuing education is all what they're looking at.
All right. That's a lot of things they're looking at.
Yeah.
I'm just kidding. Every school does, but all right. So something lighter now. I'll have Asha talk about this.
All right, so Colorado, in my opinion, I think it's one of the best states to come and experience and learn dentistry. So it's located in the southwestern region of America, surrounded by Rocky Mountains. If you enjoy outdoor activities, of course, that's the place to be. My personal experience was every time school is, of course, stressful. There's a lot going on. They've like literally combined and made 2-year program with the supposed to be 4-year program, right? So it's like it can get hectic in a couple semesters. So doing outdoor activities really helps you, stay through and not burn out. It's such a refreshment. And I don't know, Colorado felt like home to me while I was there. So I learned how to ski, and there's ample of hiking to do around. Yeah, it's a beautiful country of its own.
Yeah, I would like to add some, Nourah, if you would.
Absolutely. Yeah, go ahead.
So yeah, I'm a big lover of Colorado. It actually broke my heart when I got to know that I had to leave Colorado and move to Chicago. I'm still mad at my husband about that because I so love Colorado. And you have to, if you're interviewing at Colorado, you make sure that you tell them how much you love Colorado, because Coloradians are very proud about their state, because of course it's a state that you should be proud about. It's like mountains. You get a view of mountains from CU clinics. That's like, there's nothing soothing than that, right? And like I said, like Asha said, every weekend you get to go to the mountains. You can calm yourself down from the stress. And then for us, it actually worked for all of us, like Asha, Namrata, and me. We are the COVID batch. Like we lost almost the first half, the third semester and the first semester of the second year in COVID. But then we were not at all stressed about it, because in spite of we had Zoom lectures and all, but we used to, because we were in Colorado, we used to hang out so much in the mountains, and we made the most of it. So anyways, the whole point is you make sure during your interview that how much you love mountains and how much you want to be in Colorado. So yeah, that's about it.
Yeah, man, I would chance go visit Colorado. Just otherwise, beautiful state.
Yep,
I completely agree.
Well, there's great things to talk about Colorado, as you can see from all of their faces. They're smiling bright when they talk about it. So if you guys are related to Colorado or you know something about it, then yeah, just like Julie said, just make sure that you talk about the state. Of course, you don't have to make up stuff. If you really don't like hiking, then don't say that you like hiking. But definitely, I hope at least your interviews are in person so you can see this beautiful place. But I think that this year you guys have virtual bench. So this is just a brief introduction to Colorado, and we'll focus most of our time in question and answer session. I put the link for you guys to rank the questions. It's just to keep it more easier. You have to rank it and you have to scroll to the bottom and send it. If you don't send it, we're not going to receive your responses. So make sure you do that. Check the chat. There's the link is over there. And Karthik just put the instructions there. I'm going to stop sharing here. I'm going to start sharing the questions so that we can look at them. And then we can have our... Okay, can you see the screen with the questions? Yes, okay. All right. So I guess the first question we have is selection criteria with interview and bench. Do you guys want to take up that question?
Sure. So, wait, Nourah, is it?
What was that, Asha?
Are we answering questions now or just waiting for the poll to complete?
Oh, no, you can go ahead and answer. So it keeps changing. So we'll just go from the top and we'll keep going to the bottom. So we can start off with the first question on the top. I think that's the one that's got most of the rankings.
Okay. So yeah, it's pretty much the same selection criteria for interview and bench prep. A lot has changed, of course, since interviewed. Our was highly different from what the post-COVID pattern of getting the acceptance is. So, of course, it remains to get an interview. Your application should stand out because I have like hundreds and hundreds of applicants and they're for 40 seats, right? So do anything to basically, you need to have a very strong LOR and everything that Zui just spoke about. That's the so once you get an interview, you will be interviewed by a team. It's a panel interview. You will have a couple of professors, alumni, as well as current ISP students interviewing you. And the questions are going to be anything from knowing you in a personal level. If they have any questions regarding your the curriculum vitae or about you, so they'll go and they'll have some questions regarding ethics, regarding dental treatment plans, and as well. So I think once you're done through with this interview, you'll have another for bench preps or bench tests. And I think the current way they're doing tests is virtual. It's OSCE. Means like they'll go through slides that amount of time, and you'll have to answer the questions based on interpretation of the however it works. So once you're done with both of these, you'll get a call, that sweet call of either acceptance or a bitter call information.
And I would also like to add something. I totally agree with Asha, but regarding the selection criteria, it's not necessary that you have to have some MPH degree or some specialty in back your country. You should be good at your work, your application, and how you do your interview. That's really matter. Show some confidence, show that how much you love your dentistry, what you have done. So if you do so, I think you should be good. So if people are thinking that they have to have some specialty or any research, it's not like that. But while you are waiting for the interview or for the bench test, definitely you have to keep trying. Do yourself in a better way, present yourself, prepare with your colleagues, show them your SOP and some answers, and then go from there.
Yeah, that's a great point, Namrata. Keep in mind, none of us who just graduated master's degree country. So you all have a chance. Yeah, just like don't have, once you're in America, try to do something to prove your passion towards dentistry. I think they'll question have, but if you have a
Yep, I agree with Asha and Namrata. During the interview, like there is a panel of 4, so 2 of which are either ISP 1s and 2s, and the other 2 are faculty members. So usually the selection is more for with the faculty, but the students there also have a chance of saying, like, if they like the candidate. So, like, when you're interviewing, address the panel with their first names or the last names, and then I would say, like, during our time, like when we had in-person bench test, we knew that CU holds a lot, and it puts a lot of emphasis. It emphasizes more on bench test. I would say it's my perspective, and then the interview. But I would say like 60% of bench and 40% of the interview. I just feel that is how the selection is done. For the online bench exam, they do have, like Asha told, OSCE. So everybody is given like 10 seconds, and you just have to, they show you an image of a crown prep or a class 2 preparation, and then they ask you if there's something wrong with the CAAPID preparation, or if the crown prep is ideal prep, or if if the margin is short. They don't ask exactly, they just tell you, like, describe this preparation, what do you feel, if this is right or wrong, and then that is how you go from there. You just tell them the deficiencies and stuff. That is how the OSCE exam is done. For the interview, we all have been there. Like, I think Asha has been a part of the panel, even Namrata and even me. So we have seen quite some students who interview. Basically, the selection criteria is everybody says just be yourself. And what does that exactly mean is actually just be yourself. Like, you don't have to portray, like Nourah just told, like, yes, I love Colorado, but maybe you don't. So you don't have to tell them. There may be some other passion that you can tell them about. I have interviewed so many other candidates, and it's quite surprising, like, how they just impress you with their own ideas. So just think about, like, how can you, because every candidate is so different, and every candidate, I believe, has some passion, is something that they have something special about. Just show them, just show that thing that I am good. Like, I believe, I still remember when I interviewed one candidate last year. She had baked a cake. Like, there's nothing that's not related to dentistry, like, but then she baked a cake, and that was an online interview. She baked a cake with CU written on it. So that just shows how prepared she was, like how badly she wanted to impress the interviewers. So it has nothing to do with dentistry. You can impress the panel with whatever passion you have. I remember one student did a mandala art and showed it to them. So just express yourself, just tell them that what you are passionate about. Yep, I think I've said a lot.
So they were excellent points. Each of you gave something extremely valuable to the candidates. I absolutely agree with all of you, especially Namrata, when you said that just because you got an interview, you shouldn't stop doing what you're doing. You have to continue to do what you're doing, and in fact, try to improve what you already have. You got an interview invite, it means they already like you. But then what are you doing to keep up that name or whatever, they looked for in you. And like Julie said, express yourself, right? I had a very tough time when I was applying to understand what be yourself was. But I eventually did. And I know it's really frustrating when someone tells you like, be yourself, right? Like, what is it? So, Julie said, you don't, if you're not great in mandala, if you're not great in, baking a cake, it's fine. Like if you're just, a regular person and, you don't do all these things, that's okay. Just as long as you're talking heart to heart to somebody, I think that's super important. And what I hope you all caught this. I think that with CU, one of their selection criteria is that you need to be a very personable person. You need to be able to connect with the people in the panel. You've got students, you've got faculty. So make sure that you're addressing everybody. Make sure that it's not that, of course, the faculty is going to make the final decision, but it's going to be like a, collaborative one. So make sure you look at everybody, address everyone, and then go from there. So let's go to the next question now. So we spoke in length about interview. So I'm going to come back to that later. How should we prepare for the virtual bench exam?
I can take that. So definitely it's different than your actual bench exam, which you are not giving on the bench. It's called virtual. So there are lots of factors. You have to know what is the ideal cavity preparation, what is the ideal crown prep looks like, what is the inlay or onlay looks like. So it's like OSCE type, and they will give you 10 seconds for each. They will just show you the picture and you have to judge what's wrong or what's right. Sometimes it's nothing wrong with that cavity preparation or crown prep. So you have to know that what is the ideal cavity prep. Or it's not only the cavity prep or crown prep. You have to also see the surrounding too. It's better that you see mouth as a whole. If you are seeing something, mention that. And in bench exam, they will also show you one either X-ray, PA, or pano. So make sure that you involve everything, whatever you saw like TMJ, alveolar ridge, then come to the dental part. And then mention what is the most important, just emphasize on that problematic part. And then they will ask you further questions if needed. But you should be prepared to present that radiograph in a systematic way, that first you diagnose and then provide treatment in a very short way, because you wouldn't have time. So what happened that if you take a little more time for one question, you won't have much time later on. So you have to be very careful about that. They won't say that you should be like speed up or take your time. It's totally up to you. So that would be most important. Good part about virtual bench test is you don't have to trim anything. You are not going to damage anything irreversibly. It's always about what you speak and what you see. So just make sure that you go prepared. I feel like it's very easy to do virtual bench test than the actual bench exam.
Yeah, absolutely. And one of the most important part of this virtual bench exam is identifying what is known as critical errors in a preparation. So they can, you need, for identifying critical errors, you need to be absolutely thorough with your ideal preparation scenario, okay? And that could be for wax up exercise or a crown prep or a class 2, class 3 lesions, right? So yeah, learn both, learn what are known as critical errors and how an ideal prep should look. And one another important thing for radiographic interpretation is this happens also during an interview. So CU interviews are not very intimidating. They're very personable. And they totally understand that we learned a different tooth numbering system and the way we call out each tooth is, very differently. So you can take your time and identify the quadrant right. That's a very big thing. A lot of people get intimidated when you show them a panograph or PA. They just see and they'll be like, okay, the screen, because this is what happened when I was in the panel. They twist your, if it's a P, they turn it upside down or right side up, and they'll ask you like, can you help us flip the PA to the correct way? So take your time to analyze, and then you'll be able to figure out the quadrant and then identify the tooth number. It's not that important that you give an accurate diagnosis. You can always say, you can always give a smart answer saying you need other diagnostic tests for me to give an actual diagnosis. So radiograph, you can only say, I see a periapical lesion here. I see a furcation involvement. Whatever you see radiographically, that's more than enough to say.
Definitely. I totally agree with Asha. So make sure that you know your anatomy really well, because as Asha said that sometimes they just turn around and will tell you, identify the quadrant. I mean, they won't even tell you, it's just like up to you that how you are identifying, and they will turn around accordingly. So yeah, definitely make sure that. And yeah, diagnostic cannot be made only by radiographs. So be on safe side and just tell them you would like to ask more question to the patient or want to do some test on that tooth, etc. So yeah.
Yep, I agree with Namrata and Asha. So just in case, if they ask you on the radiograph, if they ask you what's your treatment options, make sure that you give them all the treatment options, starting from no treatment to surgical extraction or extraction and root canal. But make sure that you give them all the options. Like if you are suggesting, if they show you a panel, and then make sure you tell them that no treatment is an option. The second treatment is removable or complete denture, something like that. So you can firstly ask them, do you want me to go ahead and make a treatment plan for this patient, or how would I go for it? Or you can wait until they ask you that how would you treat this patient? You can go ahead from there, yeah. And like for the bench exam, usually they do ask about full cold crown. So like Asha said, make sure you know your critical errors and the ideal preparations, the measurements, and that's about it actually. Like Namrata said, yeah, you can't make something horribly wrong because you're not there actually preparing the cavity. So it is just what you say, and you make sure that you know what you're saying. Yeah.
I guess
Yeah,
it's more about your mouth, right? Your hand skills right now. Yes, Asha,
yeah.
you were saying.
You can always like YouTube videos, give you a brief idea how it, I know, I mean, you've all done OSCE in India in different ways or in your country in different ways. But that really helps to understand how an OSCE exam is conducted.
Awesome. So yeah, so just, like from what everybody said, practice your OSCEs, think about treatment options for radiographs, and, look at multiple radiographs, maybe have your mom or partner flip the radiographs and give them to you, and then, see if you're able to get it right. I think that's super important, like tooth numbers and, the direction of the radiograph. Take your time, take a breath before answering those questions. So now let's look at the next question. So on the same lines, how many radiographs are you asked to interpret in the interview?
It's only one.
Yeah.
Okay.
Usually
Right.
it's one,
Mm-hmm.
just one, but like Asha said, take your time when you are doing that, because they give you time. Like I still remember when I was doing my interview, I took my own time, like about 2 minutes to analyze everything. I put everything in my mind. Okay, this I see this, and then say. And I would say just don't mess up with the quadrants. Don't say it's a huge mistake to say maxilla to mandible and mandible to maxilla. So just take your time. They are usually okay if you say, like, if you don't tell them the tooth number, it's fine. But you can say that the first molar, the second molar, that's fine. But just don't mess up the quadrants. Yeah.
Next question is how to prepare for ethical questions and case scenarios.
Right. I think I can be prepared. So if you go to ADA website, there is a lot of ethical scenarios you can get. So download them and prepare. And there is no right or wrong answer when you're, they don't judge based on their ethical values. They just want to see how ethical are you as a professional. Okay, so they're not going to judge you if they want one answer. And, you know, there's so many ways someone can show their ethical behavior towards. But to give you a brief idea, I would say go on ADA website and look at scenarios. Go through some of them. How dentists handle, right? And in interviews, they won't ask professional ethical questions. It's also be like saw your classmate cheating in an exam. How would you handle that? You know, things like that. But yeah, so those are all the things to prepare, and Google helps a lot.
Yep. I think most important stuff in the ethical question is know the definition of what ethical terms means, and that will help you to rule out like what are the ethical issues going with that scenario, and you can mention them all in your answer. Yeah, there is nothing right or wrong. It's just like how you present, and you include all the ethical issues in your answers.
All right. How do you, so what are the common interview questions they can expect?
Very common. Tell me about yourself. But yeah,
that's the most dreaded question, isn't it?
The most annoying question. Which is we have to be right. No. Yeah. From that, I think they all ask you questions based on your CV and based on your, SP. So that'll be a very so that if they have questions in your personal statement, that'll be some of the questions made individual to you. But otherwise, generic. What are your strengths and weaknesses? Things like that you any school interviews, or, and then they'll ask you ethics, and then you radiographic interpretation. So yeah.
So I would say in virtual interview, there would be around 10 to 11 questions, starting from they want to first connect with the student or maybe the interviewers, and then they will go from there. So first question would be, tell me about yourself, or there is something personal. And I think one or two questions related to their personal experience or what they have written in their SOP or in their supplemental questions. If they see something obvious, they will ask about it. And other 8 to 9 questions, depending on the time or length of answers in student giving, they will ask you very common questions like about strength and weakness, and you can find a whole kind of like list on internet. Then you can practice on. Make sure that you practice with your partners, friends, colleagues, parents, whoever is available. I would say just build up that confidence that what you're gonna answer in the right way. So
Yeah, and I want to add my personal experience while in candidates, time limit, and stand out as in sentence as you possibly can. No one wants to hear lengthy, say, paragraphs or a run-on sentence. Okay, and you want to keep their attention, and viewers are interviewing like a lot of candidates in a day, and they sit for hours. You don't want to like stress them out with, or um yeah, so prepare, so means for most generic questions, and keep them short and when you
yeah, I
Yeah.
still remember. Yeah, go ahead, Zoe.
So what I did was like I made a list of questions. I would say don't mug up the answers that you have prepared. Like I would say write down or jot down that what you want to say, but don't mug it up, because what I've seen in the past couple of years, like people blank out because the questions are the questions asked were not the same, and like it were a little twisted. So what I've seen is like candidates do answer, but then it's not related to that question. So they end up answering something the question is not related to. So like, I would say in your mind, have your circumstances that you want to tell, like, strengths and weaknesses. Yeah, you can have it in your mind. Like, you can tell them all that you have gone through and what situations have made you stronger. But then imagine, like, they have not asked that questions about strength and weaknesses, but then you can tell them about your hardships in something else. So like, don't mug up your answer, just keep all the points ready in your mind so that you can mold it according to yourself and then present it to them even if the question is different. So I would say, yeah, and like Namrata said, just prepare it with your family and friends. If you don't have anyone, what helped me is like, try practicing in front of a mirror. So you see how your facial expressions are. Make sure you smile in between because I've seen, yeah, it actually helps, like, when you smile in between it, you just make a connect with them. And be confident when you talk in front of mirror. Make sure about how your hand gestures are, and everything about your body language. It, like, even in the online interview it helps. So it's all about your facial expressions and the for half of your body at least.
oh yeah, reminds me of maybe some of you are very familiar with interviews, so make sure you look. It is really awkward when with your interviewers. That
Asha, just
maybe
1 second. I think your voice is facing in and out. I don't know if that's just happening to me. I just want to,
No,
just,
I think I feel the same way.
yeah, yeah.
is it better now? Sorry about
There's a
that.
little bit of a break when you're speaking.
I'm sorry, it's my internet, I
that's okay.
believe.
No, we're able to understand. I think it's just, reaching a little late. So, but yeah, go on, go on.
Yeah, so so if you're not familiar with how to like have a conversation on Zoom, I would say try with a personal connection first, because it's important to establish eye contact, and you have to look through the lens. Obviously, it's a lot different from in-person interview, and standing. I don't know. This is my opinion, because I feel like it's difficult to stand out on a virtual interview than in person. So you have to absolutely try your best, keep an eye contact throughout, and just your gestures really matter.
I absolutely agree with that. Just because I had virtual interviews recently when I was applying, it's super hard to make an impression virtually. And especially if there are like more than one people on the screen, you don't know who you're looking at and they don't know who you're looking at. So it's complicated, but my best advice for that is try to make yourself animated. Every expression that you give on camera is dumbed down. So you have to be more animated with the way you speak, your expressions, more smiling. It's going to look dumb, but that's, on the other side, it's not going to look so dumb. It's going to make you look more excited, more present. I found that standing helped a lot more than sitting. So I just kept the camera, I kept the camera at eye level and I stood. I had a standing table, but you can find something else that works. I just feel like you're more like in that, you have more energy when you're standing and you're talking rather than sitting. You can try different ways that works out for you. Like, Namrata said, pick somebody who is available, make Zoom calls to them and, see if they're really interested in listening to you for like 30 minutes, like 20 minutes, whatever, how long the interview goes, right? All right, so next thing, so just to keep it light, speakers interview experience. So why don't you guys tell a little bit about your interview experience? What helped, what did not? What do you think you could have done differently?
So Asha, you want to go first?
It's okay. You can go ahead.
Yeah, so my interview was in 2019, I guess, in April, and we had like in-person interviews, which was like very thrilling. Definitely virtual interview will be like very different. When you see like lots of people, you will notice that, you have so much of competition, that like so many people are coming, and then how they're gonna select. So that was the first impression in my mind. But I kept myself as me, like I was by myself. And during the interview, there are like one big table, 4 people were sitting around. Whenever they were asking questions, just be yourself. I had practiced a lot, and then I was just giving my best. I don't know what they like, because they were jotting down certain points about me. It's very different virtually, I would say, but the thing was the confidence. It's not that overconfidence you have to present, but it's just a confidence, and they have to feel like that they are giving admission to a student. They want to give admission to a student who they can teach, not to a dentist who is already like very highly experienced, and they will overcome your faculty and they will not respect the faculty. So make sure that you go as a student, you want to learn something about dentistry, and from them as a person, as a student, from your colleagues. So be a friend, be a student, be a colleague. If you present yourself in that way, I think you should be good. I had little glitches in my radiographic interpretation. I would say, I don't know what went wrong, but I had a little bit of difficulty identifying the quadrant because the way it was printed out. But I think here I am, I'm graduated. So I think overall impression matters. What you speak is matters, what you do in the bench exam. So everything cumulatively give them a result, and that will help you to get an admission.
I just before Asha says, I want to add to Namrata, just because she just told, but she is in CU, but I should say Namrata is so good. Like, she used to top all our practical exams. Like, she is the one who used to always get an A. Like, and getting an A from Dr. Town is something else. Okay, so when she says that she messed up in the radiograph, but she is so good in her practicals. Like, you have to be really good to beat her. So yeah. So that is the reason she's sitting here and graduated from CU.
I think everyone has their own skill. So it's not only one thing that helps you to get admission. It's like, I think everything. So do your best.
Yeah, I absolutely agree. Okay, points.
I think what I liked with what Namrata said is something that you all have to understand. Everybody is good. All of you are great dentists. That is why you're here. You might have downfalls in your interview. Something might not go well. That doesn't mean that you lost it all. So you still have additional opportunities where you can really impress them. So they might overlook something that you did wrong, and then look at you for who you are, because you already have your profile, your application, your interview. So just try to relax. Like she said, if something goes wrong, just dust it off and try to look at something else. All right. So I'm going to go ahead and take another question. Something related to CU that's not related to interviews. What is the CU curriculum like?
So the first semester is very didactic oriented. And it's a very fast paced. They'll just cover every basic fundamentals of your fixed removables, occlusions, and brush you up with your pretty much your first and second year general school portions. Okay. And you have your your labs where you'll be practicing in mannequins. You'll be throwing your basics of crown preps, your backs ups, your occlusion, and what else? Your class twos. So that'll be your first part of your course. After that, I think it's they'll slowly transition you to clinics, and when they do, they'll not directly just throw you. There's something called a transition clinic course where they'll make sure if you want to brush up. Some of you might have a lot of gap between your clinical, so you're practicing. You'll have team member you'll be working, and you kind of brush up your skills. You do your oral surgery. You learn how to anesthetize on each other. So it's a fun transition clinic. And then once you transition into clinic, again, it's very gradual, very soothing experience. They'll transition you to perio first, where you'll do a lot of hygiene, and then you'll slowly become an independent clinician in school. The best part is you will be in charge of your schedule, of your clinic hours. Okay. So you will have a certain requirements to complete before you graduate in every department. Say restorative, you have certain number of class 2s and class 3s you need to, and class 5s, whatever, to get done before you're done with restorative requirements. Okay. So you will be in charge. They'll give you that list right in the beginning. How many dentures you need, how many extractions, and how many crown preps and everything. So, and also you'll have a coordinator who'll assign you patients in school. So work on that. They'll train you with your patient management softwares, and here in CU we've been using Axiom. So they'll really, the IT will really train you how to work on that, and it'll be very smooth for you. Yeah, so make sure you're done with your requirements in a good time frame, and usually your coordinators are very good. They'll help you a lot, push you through if you have any difficulties, and more so your faculty really is a family, pretty helps you. You're not left stranded if you have any questions and concerns regarding patient care. If you don't know a procedure, how to go about it. We've always had the opportunity as a of time before scheduling patients. So that's that. And yeah, your didactics could go, and I think it's fairly your first semester, your didactics are pretty spaced out, so it's not something to cope up with.
Yeah. In CU, the first 2 semesters, I would say, are pretty fast paced. Like, they really do test when in the interview, when they ask you how are you able to handle stress, they really do test you on how to handle stress in the first 2 semesters, because it's pretty fast paced. And sometimes you do have like 2 exams, 1 midterm, 1 final in 1 single day. And it's pretty difficult. I still remember not sleeping and just studying. Just the first 2 semesters in CU were difficult. And then after that, 3rd semester, we start doing patients. So it's pretty chill. And then we have something called competency exams. So after we do certain number of patients, we have to give an exam on patients to show that we are competent to do the procedures by ourselves. So basically, competencies are you do a class 2 preparation on the patient, and then don't ask the faculty to, they don't tell you the modifications. You have to tell them the modifications. I do see some caries there. I want to go beyond 0.5 mm on this wall and then go from there. Basically, they are preparing us for your licensing board exams that as well. So that is how it works in licensing board exams. Other than that, yeah, you must be pretty much done by the summer semester of the 2nd year, and the fall semester is just wrapping up things. CU actually does a pretty good job with training you on patients. Really, like, I feel that after coming out of school, I've seen they do pretty good. Yeah.
Yeah, I would like to add something about first semester. We don't want to scare you. It's just all about time management. We all can do it. I mean, it's just about like how well you are prepared from the beginning. So just don't get stressed out. We are students, we are here to learn. And I think we all enjoy those years, whether it was like very stressful or whether it's very busy. And it's beautiful Colorado. You can always go on a weekend for hiking or something. They have nice restaurants too. You can go over there whenever you are feel, and they have some good coffee centers in campus. So it's all about, I would say, time management, and then you will be done very quickly.
And then you're going to miss this time in school.
You miss Colorado if you're moving out.
Yeah.
Guys, so since we're closing towards the time, what I'm going to do is I'm going to stop reading out questions. I'm going to open it up in case like any of you guys have questions that you feel are unanswered. Just unmute yourself and ask your question, and then we'll take a couple, maybe like 3 to 4 questions, and then we'll close the session.
Hey, this is Sahiti. Thank you guys for doing this. I have a question. So for the radiographic interpretations, what are the sources from where we can prepare?
So I would say in your routine practice, so go online, print out like different radiographs. If you're working as an assistant, observe different radiographs of patients, try to diagnose which quadrant it is or what kind of radiograph it's, whether it's bite wing, TA, or pano, or whatever you call. Try to identify that first. Then the hard tissue, soft tissue, whatever it's visible, try to check about that. And I think you should have your own system, how you're going to interpret your x-rays. Make a list that, hey, if there will x-ray come, these things I'm going to see first and this going to be second. So it will be a rhythm. And try to practice, like you will find lots of radiographs online, and show it to your colleagues, show it to your dentist friends, and then go from there. They won't ask you like abnormality or anomaly or some defective, very huge disease radiograph, it's going to be very simple with deep cavity, periapical lesion, maybe horizontal bone loss. So it's not going to be very crazy. But if you see something abnormal, you can just generalize it, like whether you are seeing radiolucency or radio opacity and you want to do something, you would like to do some further test regarding it, or maybe you will refer it to some specialist. Very short and simple.
Honestly, I
Thank you
would
so
say
much.
also I would like to add, Nourah has made quite some good videos on YouTube, which are accessible to everyone. I would say just go through those videos. She has really helped a lot of students with those X-rays there. So you can find them on YouTube. She has done a very good job.
Thanks, Chewy.
The chat that's asking, Dr. Miriam is asking about if they emphasize compensated dental assistant. I've never come across this discussion with any of the faculties in CU. So as long as you have some passionate dental experience in the United States or from your home country, it really doesn't matter what sort it is, whether compensated or voluntary, you're fine.
Makes sense. Saiti, just to add to your question about radiographic interpretation, just like Namrata said, or that use terms like radiopaque, radiolucent, and instead of coming to an exact diagnosis when you are interpreting it. And a good idea is to go over the textbook that's for radiographs. So just go over your radiology textbook, where you can read about the normal anatomy. You do not want to point to something that's normal anatomy and say that's pathology. That would be a grave mistake. So like we spoke about tooth numbers, quadrants, also look at normal anatomy, so you know which one is what. And then I know Radhika is raising her hand, so we'll have her ask her question next.
Hi guys, thank you so much for arranging this webinar. Yeah, my question was, what advice would you give for the person who would be interviewing at CU?
So basically, you would have identified what was your weakness from your last interview. I would say work on that. If it was something related to identifying errors or OSCE exam, or forgetting to be yourself during the interview. So yeah, just work on what you lacked. And one thing is, right after the interview, it's always a good idea to give a writing thank you note to all of your interviewers. And you can always reach back to the students or your faculty and ask them what was their opinion, where you went. So I'm not 100% sure you'll get a response, but I personally responded to students saying, you were good. You can basically, but if it's related to your bench and your skills, that's the only way you can identify is by your experience during the interview. So yeah. And reapplicants do have a chance.
Yeah.
So
Yeah, I think there is
did you interview last year?
Yeah, you were actually one of the panelists in the interview.
Oh, I'm sorry.
No, it's fine. You so many people, you wouldn't remember me.
Okay, so what I would say, CU is actually very good in getting back to the students. You can always, at least we don't have Marcy anymore with CU, but Marcy used to always give you a review, like what did you mess up or what wrong did you do? Was it bench test? Or, sometimes she also used to give you the comments that we write, like during the interview, we write down some comments about the students. So if they don't like you, there are certain parts she didn't do well in this part, and they do help you. So if you can get back, I think there's still the application cycle has closed. So, but you still had the chance before getting going to the interview, you can still email them and ask like, how did I mess up last time, or what are they expecting from me? So, you know, that will also help you prepare better.
Yeah, thank you.
Okay, any other questions, guys? I think we addressed the question that another person asked you about reapplicants.
Mm-hmm.
Let's see. If you guys have any questions, this is the time to ask. Okay, are the professors at CU open to having volunteer research assistants work with them prior to application?
I think yes, absolutely. So we have some faculties who are very much into research and academics, and we have had classmates graduated from our batch who worked as a research assistant along with them before the start of the program. So yeah, you can just apply and reach out through CU portal. And yeah, you do have a chance.
Okay, are there any preceptorship programs or research related programs at CU?
Not that I'm aware of. There's no preceptorship program.
Okay.
Mm-hmm. Yep.
So I have a question. So did CU start in-person tour of the school, or it's just virtual tour or something?
Last year it was
While
virtual.
we
Yes, Namrata, go ahead.
Yeah, I think it depends. I think you can always email them and they are very good at responding. Last time it was like virtual, if I'm not wrong, but if everything is good, if you really want to take a tour, maybe they will help you, but always ask for the recent scenario. I am not sure about like how the rules and regulations are changing related to COVID, and from where you are traveling. I mean, if you are just in United States, I think they should be able to do it, but it totally depends. I think you just have to book in advance and take an appointment for the tour. So yeah, just to follow up with them and they might be able to get you in for the school tour.
Okay. Also, another question, like if a person is out of United States, does that affect the application? Like, no.
No. They see everyone equally. So it doesn't matter if you have like whatever visa status you have, they will prioritize the candidate according to their ability and how their interview went. Yeah.
Also, I want to add on to this. So, being totally honest, yes, CU is one of the schools who take, I think, second largest intake of ISP international students. So during my interview, I think they made pretty sure, and they're pretty open about it. Like, you know, during my interview, they were pretty straightforward. They told us that this year onwards, they are going to reduce the number of students on visa. So in my batch, like there were to a ratio of about like at least 4:1. Like out of 40, we almost 10 students were on visa, F1 visa. So just be prepared. You have to be like, I understand, like, because I'm on visas too. So you have to be like really, really super good. Okay. So just be, I'm not like taking anybody down or like, you know, not demotivating you. I am here. So can you be, but just be super prepared. Like, you know,
Yeah,
you have to be there. Yeah.
Yeah, I'm applying on visitor's visa, so I was a bit concerned that
It's not impossible, but it's competitive. We all know it. It's just the unsaid fact, but CU does tell you. And like, you know, when I did an interview, I almost, on that day, I almost was a little bit shaken up because I wasn't expecting thinking that they would say it upfront that they are going to reduce the, just because how things are in US because of the visa and with COVID and stuff, things have been difficult. So it's okay. You can be prepared. You know, I'm not kind of demotivating you, but just be prepared. It's possible. We have 10 students. We have had 10 students in our batch, and we do have other visa students in our junior batches as well. So it's not impossible. It's just that you have to be competitive. It's competitive.
Okay. Thank you so much.
I think there is one question about fresh graduate. I think we have 3 or 4 fresh graduate in our class. So I think it doesn't matter. It's just about like how you present. Definitely it's like more competitive, and it depends on the faculty and panel whom you are giving and what their perspective about the experiences. It doesn't let you down doing anything. I mean, you just have to try, because you will be having a time between your graduation, your application, and your interview. So make sure that you utilize that time very wisely and show yourself that you have done something meanwhile. And I think that should be good. But I think, Zoe, we have 3 or 4 recent graduate, right, in our school.
Yeah. Yes. For
So,
sure.
yeah.
Like our batch had variation from the age of 27 to 55 or even more. So you see the variation in experiences everybody had. So like, you know, it's nothing like new grad or 10 years of experience, no clinical experience. It doesn't matter. It just how you portray yourself and just put up your best points that you have.
Great,
I mean,
awesome.
we all are here to be student here, so they want to make sure that they are giving admission to a student, as I said earlier. So they are looking for someone who can be teachable. Yeah.
Yep, that's the word. You got to be coachable. You got to be somebody who is, you know, open to learn, and that's something that they can see through you when you're interviewing. There's an interesting question here. I think you guys can answer it. Does CU have a motto or something that they strongly believe in?
Ethics. In short, yeah, they really emphasize on, you know, your ethical professional attitude. Stay up to it and treat all your patients ethically. That's very, very important, and I think that's the biggest standout for you.
Yeah, I agree.
So yeah, we're definitely over time. This was going to be a 1-hour session. I knew it was going to run over, but thank you guys for staying and answering all these additional questions as well. I know that most of our participants are having interviews coming up. I know maybe some of them do not, or maybe they've applied for CU and they're considering CU. So whatever it is, whatever stage that you are in, congratulations. You know, like we spoke about, like Joey said, CU does interview a lot of candidates and they accept 40 students. So something might have gone wrong with your interview, something may not have. Maybe just someone was marginally better than you were. So don't beat yourself up. You know, just give your best, be yourself. If you have additional questions at all, you know, reach out to Caapid Simplified and I will try to get an answer to them, as long as they're reasonable questions. So thank you everybody for joining. Thank you, Namrata. Thank you, Joey. Thank you, Asha, for taking out time out of your, you know, busy lives to be here and to be here for these students to answer their questions. If you have any final words for them at all, just go ahead and, you know, if you want to say something, otherwise we can close it.
I think also is to.
Before leaving, I want to thank Nourah. Nourah, I'm so proud of you and you're doing so good. I want to say you inspired me in a bit because you've been like, you know, all over. You're doing so good in SIU and then now in UIC, and you're going to be in Chicago, and your fitness motivation. Yes, I am so proud of you. I'm glad that I'm going to see you sometime soon.
That is so sweet, Julie. Thank you. Keep
going, keep doing all the good work.
For you guys as well. we met a long time ago, but we're still in touch. So I'm super happy that I could meet you all. And whoever is here right now, if you all could just please come on camera as a thank you for this session that we did. I'd love to just take a picture. Awesome. Okay. A couple more people. All right. Let's all give a big smile. Okay. You guys who didn't come on camera, you're penalized.
All right,
All right,
all the
guys.
best.
All the
guys.
best.
Best.
All right. Take care, everyone.
Thank
Bye.
you.